Welcome. What is hypo in blood sugar? A low blood sugar level, also called hypoglycemia, or a hypo. Throughout the course of a day, blood glucose levels can fluctuate due to various factors. Such variations are considered normal, and within a certain range. They may go unnoticed. However, when blood glucose levels fall below the healthy range, it can cause a very high risk, including coma and death if left untreated. Always consult your doctor or health care professional before making any changes to your medication or major change in lifestyle. Low blood glucose, or hypoglycemia, occurs when levels drop below a certain threshold. Typically below 70 mg/dL as measured in the US, USA or America, or 3.9 mmol/L in the UK, Australia and some other countries. It is important to discuss personalized blood glucose targets with your diabetes care team, as individual thresholds may vary. Do not forget to hit the like button while watching this video. We will go to them in detail later in the video. Symptoms of low blood glucose can manifest differently in each person. Recognizing these signs is crucial, and keeping a record of personal symptoms can aid in understanding individual responses to low blood glucose. Symptoms range from mild to severe, encompassing shakiness, anxiety, confusion, rapid heartbeat, and, in extreme cases, seizures. If you are old and had diabetes for a long time, you may not feel all the symptoms of hypo. In such cases, you need to be extra vigilant. To ascertain low blood glucose, checking blood glucose levels is the definitive method. If unable to check levels and experiencing symptoms, it is essential to address hypoglycemia promptly. Low blood glucose triggers the release of epinephrine, causing symptoms like a racing heart, sweating, tingling, and anxiety. Prolonged low blood glucose can impede brain function, leading to blurred vision, confusion, and, in severe cases, seizures, coma, or, rarely, death. If you are taking medication that can cause hypo, it is important to carry a sweet, quick-eating carbohydrate when you are traveling. The 15-15 rule is recommended for treating low blood glucose. Consume 15 grams of carbohydrates, wait 15 minutes, and recheck blood glucose. Repeat until levels are at least 70 mg/dL, or 3.9 mmol/L. Suitable sources include glucose tablets, gel tubes, juice, soda, sugar, honey, or hard candies. Do not make it a time to have a party with all the sweets you have been dreaming of. It is advised to avoid overeating to prevent subsequent spikes in blood glucose levels. For severe hypoglycemia, you may have to contact for emergency assistance. Self-treatment not possible. Any other severe cases where the person is in a coma. Qualified emergency personnel may administer glucagon. This hormone stimulates the release of stored glucose from the liver, raising blood glucose levels. Instruction on what to do in case of a hypoglycemia should be provided to those in close contact with the individual, including family members and co-workers. Potential causes of low blood glucose include insulin dosage errors, insufficient carbohydrate intake, the timing of insulin or medication relative to food consumption, and physical activity. Regular monitoring, especially during changes in routine or increased physical activity, is essential to prevent hypoglycemia. Listen to the end, we are in the middle of the video. But hit the like button while watching this video. A medical ID is recommended, with important information about diabetes, medicine use, allergies, and other pertinent details in case of emergencies. Hypoglycemia unawareness, where symptoms are not felt even at low glucose levels, poses additional risks. Continuous glucose monitoring and adjustments to glucose targets may be necessary for those experiencing hypoglycemia unawareness. To regain hypoglycemia awareness, avoiding low blood glucose for several weeks is advised. While this may temporarily raise blood glucose levels, it helps the body relearn responses to low glucose. Monitoring blood glucose regularly, either with a meter or continuous glucose monitor, CGM, is a proven method to prevent hypoglycemia. Understanding the causes of low blood glucose, along with providing detailed data to healthcare providers, enables tailored adjustments to insulin doses, exercise, and dietary habits to reduce the risk of hypoglycemia. Especially during the night, blood sugar can go too low. This can happen with insulin, and some other glucose-lowering medication. To prevent or correct very low blood sugar levels, adjusting the dose or timing of diabetes medication or insulin may help. Talk to your health care provider and discuss if this issue keeps happening. I will give you a summary of what to do next in the video. See the description and comments for references. We would appreciate your comments in any language. 1. Avoid simple carbohydrates. Avoid high GI foods, sweets, potatoes and pasta. Stick to low GI foods like beans and legumes. 2. Change your dose or timing of diabetes medicine or insulin in consultation with your doctor. 3. Switch to a different diabetes medicine which does not cause hypo. 4. Try an alternative like SGLT2 medication instead of insulin or hypo-causing medication in consultation with your doctor. While we are in the middle of the video, thanks very much for watching this video so far. Do not forget to click the like button. It is advised to avoid overeating to prevent subsequent spikes in blood glucose levels. Adjusting medication, timing, or meal choices can be strategies to manage these issues. Change your dose or timing of diabetes medicine or insulin. Switch to a different diabetes medicine. Do not forget to click the like button and subscribe. Thanks very much for watching this video. Up above you see 2 videos related to health. It will be more helpful to you and your family. Have a great day. See you in the next video.